Shifting gears a little now, the Health District's Rosanna Silva-Minnick looks at a way in which adults can prevent disease and help keep our community safe through immunizations.
Regular program viewers will know how we stress the importance of childhood immunizations. However, many adults often think that other than the odd tetanus shot or travel vaccines, their days of getting shots are over. However, that is not quite accurate.
I believe it's very important to realize that after leaving adolescence or teen years, there are vaccines that can prevent vaccine-preventable diseases in adults. And there are quite a few that's recommended by the CDC.
Vaccine recommendations for adults are always evolving. For example, the tetanus shot you need when you step on a nail in the backyard has now evolved into a Tdap shot, adding the vaccine to protect against whooping cough. Whooping cough or pertussis is a P in Tdap. The T is tetanus. And the new recommendations come from a resurgence of whooping cough outbreaks in neighboring states. Adults being immunized will help protect our community's children.
At age of 20 to 40, really there's, if you're talking about tetanus boosters, now the recommendation is to get at least one dose of the Tdap, which has the pertussis or the whooping cough component to it. As you know, there has been some outbreaks of pertussis in neighboring California and other states, so that it's now recommended that one of the booster shots for adults should be a Tdap.
Young men and women up to the age of 26 should consider the HPV shot to guard against the virus that is known to cause some cervical cancers. HPV is transmitted through sexual contact. If possible, every adult should have an annual flu shot. And for our senior population, you may want to consider some additional vaccines.
The pneumonia vaccine is for those who are 65 and older. And then we have the shingles vaccine, or also known as the zoster, and that's for folks who are 60 years and older.
For anyone traveling abroad, information on immunizations is available at any health district office.
A recommendation for people who want to travel and would like to know what kind of vaccines they need is to come to the Southern Nevada Health District and speak with a nurse so they can consult and let the nurse know exactly what countries they're going to travel to, and they can get the recommended vaccine as well as the required vaccines for those countries.
The Centers for Disease Control on its website has a short interactive questionnaire you can fill out to determine what vaccines are recommended for you. It will give you the information you need to talk with your doctor or one of the nurses here at the health district. Certain jobs like food handlers and daycare workers have special requirements, and all of that information is available on our website, snhd.info, or by calling us at 759-1000.
We had an event in partnership with other community agencies here. It was called the Homeless Connect, and we provided free flu vaccines to the homeless population, and we also provided some hepatitis vaccines as well. But yes, we do provide some vaccines at that particular event. On top of that, we also offer outreach clinics to the community, and we do list that in our website so that people can come and get their vaccines, and those vaccines are at no cost to the public when we do our outreaches. Occasionally we do some in the churches, we do some faith-based organizations who request for the flu clinics, and when we do advertise it, it's open to the general public.
Staying current on immunizations protects not only yourself, but the community as a whole.
Immunizing people actually gives us what many people refer to as the herd effect. When we are all protected, it really helps to protect everybody else in the community. There are certain segments of the population who cannot be vaccinated because of perhaps some underlying conditions, so that when the more of us that's protected, it kind of protects everybody else that cannot be vaccinated as well. So public health perspective, preventing vaccine-preventable diseases protects the community.